Ah, hey, Professor, in all seriousness, nandun kayo sa Malacanang. I'm wondering if you were able to talk to Secretary Duque. Now, of course, we've been talking about, as you said, your methodology really centers around the R naught. We've talked about death rates, case numbers, and so on. We're also talking about doubling rate. Did you have time to clarify with Secretary Duque what exactly he was referring to when he first said, I mean, let's say he did qualify it, but what exactly what is he referring to?
I think, Robbie, the value of our experience yesterday was we were able to talk to the implementers and get firsthand information from all of them. You know, we are in a crisis, a health crisis, which is very complex. No, the response will require not just equipment, resources, financial and human resources. It will require a high level of coordination and collaboration between civil society, the private sector, and business. And the conversations we had during the breaks were very instructive. For example, we still have problems with data, and it's not because somebody's hiding it. It's because really the nature of data management in the country before the pandemic was already problematic, But slowly it's changing. It's improving. We were able to talk to Secretary Duque, and again, we were talking about the bending of the curve and all of these things. No, again, the idea was to link up with implementers. We're researchers. We're not even the experts, and we were very clear to point that out yesterday. The real experts were sitting beside us: epidemiologists, doctors. We're really people who synthesize data, who look at forecasts and numbers, and try to provide some sense, systematized data for decision making. And we
Speaking
expressed
of
that to
that,
the president.
speaking of that, the last time you guested here, you were talking about specifically. You said there were a lot of data na hindi categorized. There were a lot of areas that of data that were missing. For example, information on locations. Are we still encountering the same types of problems with the data?
Robbie, we're worse off now than we were when the last time we talked to you, and we did include it in our discussion paper, which I think we will be posted in the UP website possibly tomorrow. And the uncategorized cases, the cases without location, has made it extremely hard for us to do forecasts, granular forecasts up to at the LGU level. We would like to help LGUs now. Doing forecasts for the country is good, it's informative, but it's really helping at the LGU at the granular level. That's I think our challenge now. But we can't seem to get good data. But the important thing about yesterday, the linking up with implementers, is now we have a relationship. In a sense, they can share data with us, and we can help them systematize it. The idea there is now that we have this linkage. We can try to make use of this linkage to improve our forecasts and projections, not just for government, but for the public also, so they can better understand where this pandemic is going.
Sir, I don't get it. Why is the quality of the data worse? It was supposed to be getting better as we go along, diba? Why is it the other way around?
Professor David has a lot to say about that.
No, I don't have a lot. I have something to say. Yeah, but we asked with some of the people from DOH, and they said yung the problem is nasa test centers. When they return it, hindi complete yung information. But at the same time, it was before last time we spoke. It was around 2,000 cases, and it's up to about 9,000 plus cases na uncategorized, and that makes it really difficult to do trend analysis on as Professor Ranjit says, on a granular level. Parang, how can we say, kunyari, for example, Cebu is improving if meron palang missing data that we are not incorporating? I mean, of course, Cebu is improving, but how can we say, for example, if NCR will be improving if there is missing data? So that makes it a big challenge.
Prof, balik ko lang sa inyo yung tanong nyo. How can you say that Cebu is improving kung missing pala yung data? I mean, because on the one hand, you said, how can we say that? And on the other hand, you're quite unequivocal that, well, actually, Cebu is improving. So how can you make that kind of a statement?
Yes, well, actually, we are confident that Cebu is improving based on what we see. We do make allowances, these uncategorized cases. So we make certain assumptions in including them in the count unofficially. So we look at different metrics naman, not just the case count, but also the positivity rate and the hospitalization rate. So based on several indicators, we're seeing an improvement in Cebu. But what I'm saying is, in general, or even in an LGU level sa Metro Manila, we also have uncategorized cases. For the LGU level, it's more difficult to make certain assumptions because uneven yung trends nila. But for NCR and Cebu, we can make certain assumptions. At least we can sort of make an inference on how they're trending based on their numbers.